is Dr. Joel Shumway and from Shumway Dental Care, and today we're going to be talking about periodontal disease. A lot of people wonder, what is periodontal disease? How do you know when I have it? What can we do to fix it? And what kind of treatments there are? How do you know if you have periodontal disease? There are a few signs and symptoms of periodontal disease. Puffy gums, gums that bleed when you brush, gums that bleed when you floss, gums that just ache. That's a sign of gingivitis. Gingivitis can lead to periodontal disease. Periodontal disease is the loss of the bone and supporting structure around the tooth. So once you start to have gingivitis, it will lead and progress towards periodontal disease. How do we fix it? Unfortunately, once patients have periodontal disease, there's really not much we can do to fix it, but we can keep it from getting worse. And that's the goal with periodontal disease. We want to stop it from progressing and maintain what the patients have. What we do to stop it is we need to do what's called a scaling and root planing. Scaling and root planing is a little bit more thorough than a simple cleaning. Okay? The patient would be numbed up and the hygienist would clean underneath the gums and clean out all the infected and affected tissue and also the bacteria. Clean it up nice and clean and smooth, and then we wait 6 weeks to see if we have healing. Also, what we do in conjunction with the periodontal disease, we have a laser that will help kill some of the bacteria that causes periodontal disease. And so the combination of laser therapy and also scaling and root planing works really well. I like to refer to kind of periodontal disease like diabetes. Patients that have diabetes, a lot of times they can lose weight, or they can, there are certain things to maintain it. You hear on The Biggest Loser how, after losing 30, 40, 50 pounds, they have stopped needing insulin. But if they were to gain it back, they would have to, eventually get back on insulin. With periodontal disease, we can stop it from getting worse, but unless the patients are diligent in keeping their recommended cleaning intervals and also brushing and flossing twice a day, it will probably come back. The good news is, though, that patients that are diligent, we can stop it from progressing and get the mouth and gums healthy again. If you have any questions, if you feel like you need an exam or it's been a while since you've been to the dentist, please call us and we'd love to have you as a patient.